Hi. A few weeks ago, there was a meeting between government and non-government organisations, community advocates and lawyers where all agreed that the Mental Health Act 2016 is not meeting its stated purpose and is overdue for assessment and reform. Now, technically the reform process has already started, with the Office of the Public Guardian releasing a paper called Better Pathways, Improving Queensland Delivery of Acute Mental Health Services, released in August 2022, and another paper titled Proposal that the Queensland Mental Health Act be reviewed, a discussion paper, which was published in March 2026. These are available on the Office of the Public Guardian's website for you to read. Going into the meeting a few weeks ago, I don't think anybody expected there to be such a clear consensus on what needs to happen moving forward, yet there we all were largely agreeing that 1. The Mental Health Act 2016 has failed in its stated purpose. To remind you, its stated purpose is being to reduce the rates of involuntary treatment and use of restrictive practices. Both of these things have increased. The Mental Health Act 2. The Mental Health Act must centre lived experience at all levels of service provision and governance. And 3, human rights and accountability must be built into a Mental Health Act. There was also a general agreement that structural change needs to be built into the Act, but one of the biggest issues we are facing is that the general public and political will for change is just not quite there yet. This is in part because people don't understand the way the Mental Health Act really works and the impact it has on everyday people. Realistically, research into the effectiveness of things like mechanical and chemical restraint are very clear. The use of restrictive practices are inherently harmful to both patients and staff. This was reflected in participant views in the meeting about reform, with one former patient stating, the smallest measure of expressing emotion led to multiple types of restraint and seclusion, mechanical, physical, and chemical. It was just me expressing distress. If you have any kind of emotion and the system is too scared to handle it, the system will often traumatize us for change. A healthcare worker confirming, stating, staff who want to take a rights-based approach have to put themselves in legal and other kinds of danger because the system doesn't support it. It's under the table, which isn't a systemic solution. One of the biggest barriers to attitude change is simply not understanding the issues at hand, which is why I am sharing research papers, discussion papers, and investigation reports on my accounts. In order for us to create a healthcare system that we all need, we need you to engage with this too. You can help show your support for patients and healthcare workers, and it doesn't need to take up all your time or cost you a thing. But you will benefit from it because ultimately, just like we do, you also rely on Australia having a positive functioning healthcare system. Here are 2 simple things that you can do. 1. Queensland residents can sign petition 4521-26, Independent Investigation into Force Feeding Practices, and share it with 3 friends. That petition is open until late August. We really want to reach 1,000 signatures. We're currently at 530. 2, our society encourages individualism over community and collective ways of being. This does impact all of us, so consider a time where you may have met somebody's distress with judgment instead of compassion, and what you could do differently next time, because there will be a next time. Thank you.